There are classes of medicines that do that, especially some of the older classes of beta blockers. We have newer beta blockers that don't do that anymore. But more importantly, we need to recognize that ED is a sign that you probably have heart disease and that you have clogged arteries down in the pelvic region, and that our arteries tend to clog all over our bodies at the same time. And that that is one of the signs that we don't have good arteries, because your arteries can't open up anymore, which means they're clogged. So the goal here is to don't have clogging of any of your arteries, especially the ones that lead to the pelvic region. So when you are very young, you need to start looking at the diet that you're eating. The men's diet is supposed to be steaks and hamburgers and lots of eggs and things like that. Well, all those years that you spend in your adolescence eating that kind of food so you can bulk up to be a football player, you're basically clogging the arteries to your pelvic region and advancing the chances that you'll have ED. And your cholesterol is up at that time, your sugar may be up, and we know that diabetes causes problems with erectile dysfunction as well. And then if you smoke, you significantly accelerate that process. So one of the major side effects of smoking is going to be the problems that it does in terms of clogging the arteries, especially those in the pelvic region. So your goal is to, at a very young age, begin to change your diet so that you don't end up with clogged arteries, and that primarily comes from the animals that you eat. So if your cholesterol, your bad cholesterol is not under 100 when you're very young, then you need to look at the amount of animals that you're taking in and begin to reduce it at that point in time to some of the lower cholesterol animals like fish and the poultry, and even some days when you don't have any animals, some meatless days, so you keep your cholesterol in the range it needs to be so that you don't end up having ED.